The shaded streets around Multnomah County's Central Library have become a hangout for people like this man.
For about 5-6 years.
Being homeless for that long in Portland, for him, comes with other challenges.
I use methamphetamines and fentanyl as well.
The library is a spot many go to use those drugs, especially inside the library bathrooms.
But I think it's starting to be one of the only spots that's always open and available. And since usage is kind of up in this area, you know what I mean, that it's an easy option, you know what I'm saying, to when you're trying to hurry up and get yourself well.
After complaints from library workers, in 2022, Multnomah County had the CDC do a health hazard evaluation to look at exposure to illicit drugs among library staff. The results were released this month.
And every time I come down here, this is just packed. There's just people out here using drugs, trading drugs.
Last summer, the CDC's National Institute for Occupational Safety and Health looked at 3 county libraries, Hollywood, Belmont, and Central. They talked with 95 employees. Just over 1/3 reported being exposed to drugs, mainly fentanyl. Some said it happened daily. 19 experienced symptoms from the exposure.
They were having headaches, they were lightheaded.
And most believe they are likely to experience workplace violence due to illicit drug use in the library. Manuel Arellano is a library assistant and lead steward for the Library Workers Union.
We cannot stop it, unfortunately, because our libraries are open to everybody and for everybody. But training in order to identify the problem.
80% of the employees interviewed in the CDC study said drug use in the libraries increases their level of job stress. 65% said the library's guidance on how to address the problem is inadequate, and 34% said they don't know how to protect themselves.
We are not trying to stigmatize people who uses drugs, but also we are trying to prevent and to train coworkers to report if they are exposed.
The report gave the county 4 recommendations, including improving restroom ventilation and increasing employee training.
Definitely. I see people coming out of there faded.
But just the fact that something is left in restrooms that the public is using, and if you're here with families, it's concerning.
A spokesperson for Multnomah County sent KGW the following statement, saying in part, Multnomah County does not allow drug use in the library. Illegal drug use on library premises violates Rule 1 of the library's behavior rules. And patrons who violate this rule may be excluded from all Multnomah County libraries for up to 1 year. The report validates the steps Multnomah County has already taken to protect health and safety in public spaces. Our hope is that this research will not only benefit Multnomah County residents, but also people using public libraries and public services nationwide. The Portland Police Bureau tells us they do routine drug enforcement missions around Central Library. In that neighborhood just last week, alongside state police, officers arrested 39 people and sent 20 to deflection. That's the option of treatment over jail for those caught with possession of hard drugs.
You got to use somewhere. And so that's what it's like, leaving them no other option but to use inside there if they don't want to go to jail.
It is a society problem. It's a social situation that unfortunately comes to our buildings.
So Multnomah County libraries, they have an overdose policy and kits of Narcan, that's the overdose reversal drug, at each location. Staff also has access to gloves and N95 masks if they feel they need them to avoid possible drug exposure. Now, as for the issue with the restrooms, because according to the study, that's where people are using drugs inside the libraries. The county has a procedure for that too. It's to close the restroom for 30 minutes after suspected drug use to allow for ventilation. Now, in one of the 3 libraries that the CDC looked at, the restroom vents were not working. We're told that's now being fixed. In fact, in one bathroom, a syringe was found stuck in the ceiling during the CDC inspection. But this opening and closing of bathrooms is just another task that library staff have had to take on in recent years that has nothing to do with books, as the drug crisis in the surrounding neighborhoods continues. And now libraries have always been a mirror of the community. That's why those we talked with today were not necessarily surprised by the results of this study. And Portland Police encourages people to report concerning behavior when it comes to drug use at libraries. Okay, now it's your turn to weigh in. Have you witnessed drug use at the library that you go to most often? What do you think should be done about it? Email the story at kgw.com or call and leave a voicemail 503-226-5090.